be vigilant when it comes to symptoms. So I'm going to tell you the exact red flag symptoms. And my point to you is don't sweep this under the carpet. She was 31. She ate clean. She did yoga. She looked healthy. And I found a massive polyp during her colonoscopy, a polyp that definitely would have turned into cancer. And she had no symptoms. That's happening more often than it should.
And for decades, colon cancer was considered to be an old person's disease, but that, frankly, is simply not true any longer. Hi, I'm Chuck Carroll with the patient perspective, and with me is board-certified gastroenterologist and three-time New York Times bestselling author, Dr. Will Bulsiewicz. And this is the Gut Insiders, and this episode, Dr. B, might just save somebody's life.
Literally, this is one of the most important topics happening right now.
Now, here's the thing. When I knew that we were going to be doing this episode, I dove headfirst into data and I pulled some statistics, and I've come across some things that, frankly, it scares me. Right? The American Cancer Society estimates that 159,000 Americans, almost 160,000 people this year alone, will be diagnosed with colorectal cancer. That is 1 in every 25 people over the course of their lifetime. And it also happens to be the number 2 cancer killer in the United States. More than 55,000 people will succumb to this form of cancer this year alone. But the part that really, Dr. B, got my attention was this. It is that colorectal cancer is now the number 1 cause of death in American men under the age of 50. We're talking about strapping young men. Number 1. And it's number 2 for women under 50. Now, when you compare that with adults who were born around 1950, people born in 1990, then 40 years later, they have double the risk of colon cancer and quadruple the risk of rectal cancer. So my question to you, Dr. B, is what is going on here, man? Why is this happening?
Well, Chuck, first of all, I want to commend you on that thorough research that you just did. That was quite impressive. Everything that you said is completely accurate and real. And the thing that you have to understand is by the time it shows up in the research, by the time that we can actually see it in the numbers and the data, it's already been happening for years. And I've seen this firsthand in the care of the patients. I mentioned right at the jump off, the 31-year-old mom, right? I've seen this in soccer moms who do yoga. I've seen in fit dudes who are at the gym smashing weight, or they run and they eat healthy. And, what I've come to realize is you can't judge a person's risk based upon how they look or the quality of their lifestyle. The risk exists for all of us living here in the States, and you could look totally healthy and still have a large polyp that is developing and is not causing any symptoms. And when I have been fortunate enough, and I say that like I'm serious, I feel fortunate when I find these polyps because I breathe a massive sigh of relief, because when I see these polyps in these young people, I know it's not a matter of if, it's a matter of when that was going to become cancer.
All right, so let's break this down, right? So a polyp, people hear that, they know it's not necessarily a good thing, but you just mentioned that you breathe a sigh of relief. So break down scientifically, nerd us out, what exactly is a polyp?
Yeah, so a polyp is basically the precursor to developing cancer. We think that nearly all cancers go through this pathway, where first you have normal healthy tissue inside the large intestine. This is the colon. First you have normal healthy tissue, and then you'll pop up the smallest of small, 1 millimeter polyp that looks like the tip of a pencil, and it doubles and it doubles and it doubles. Next thing you know, it's an eraser tip. Next thing you know, it's a blueberry, and then it's a raspberry, and it keeps going. And this polyp, if you give it time and you let it to continue down this pathway, there is a risk that ultimately it could become cancer. And so basically a polyp is a growth on the lining of the colon. And we think that it takes about 10 or 15 years for this process to play out, going from normal lining to small polyp to big polyp to cancer. And that 10 to 15 year window, like from my perspective, and I mean this wholeheartedly, That to me is a gift, because if we could just find that polyp, we could actually remove it. And the removal of a polyp is basically like cutting off cancer. Like you're basically chopping it off before it ever becomes the thing that's so dangerous and threatening.
10 to 15 years, that's a pretty big window. So we're talking anywhere between a decade and a half there, which leads me to believe that there is a lot of opportunity to catch a polyp early. So what happens when you are able to catch it early?
The general problem that we have is these don't cause symptoms in the vast majority of cases. Very few polyps will actually cause symptoms. You wouldn't even know. So this 10 to 15 year window is basically this period of time. There's no symptoms, but if you happen to do a colonoscopy, that's how you find that polyp. And then you quite simply, during the procedure, remove it completely painless. The patient can't tell whether you did anything during the colonoscopy or not, because there's no pain associated with this. So, but you simply remove that polyp. And again, then you have like basically like shut down the risk of that particular thing turning into cancer.
All right. Well, let me ask you this. The big why question, right? We were just talking about in the statistics, like this huge surge in cases over the last 4 decades, the difference between people being born in the 50s and in the 90s. What is driving this explosion among younger people?
Yeah, I mean it's a scary thing. This is our generation, and if it continues down this pathway, it will affect our kids even more. It seems to be multifactorial. Like I don't think that we can put this all on one specific thing. So a few of the key drivers that we think about, Chuck: ultra processed foods, right? 60% of the adults diet, but 70% in our kids. The lack of balance between red meat, processed meat, and fiber intake. So it's not just that people are eating red meat, it's that people are eating large amounts and they're not balancing that against fiber. And that's not a formula that you want to have. We're too sedentary. We're not as active as we used to be. I remember being a kid before Nintendo, and I remember being a kid after Nintendo, and they were not the same. And then truly, and then alcohol. So alcohol is carcinogenic, firmly established, and this is one of the particular spots where that carcinogenicity, the way in which alcohol causes cancer, shows up most powerfully. So these are the things that I see as being like having the most strong research to back them up. There's other things that I do think should be layered in there that have to do with our lifestyle and basically life within the modern world: chronic stress, circadian disruption, irregular sleep patterns. For people who work shifts, I have in many parts of my life, shift work can do that. Being in constant fight or flight mode. All of these things ultimately impact the microbiome and keep the body in a state of inflammation.
Lots to unpack there, but I mean, you kind of just hit on a lot of the things that are celebrated in our culture, which is, sitting down, like maybe building a man cave, watching every game known to man, eating junk food, and drinking beer throughout each and every game, right? So you're kind of crushing
Is
hearts.
this a theoretical, Chuck?
It
Yeah, are
might
you
be.
asking for a friend again?
Yes, I am asking for a friend. Well, we could be talking about earlier me, but this current version tries to take a little bit better care of himself.
Okay.
Although I
Okay.
do
I
anyway.
celebrate that.
Yeah,
Hey, me
but
too, man. Me too.
thank you. Thank you. But let's unpack these things individually. Let's start with what I think is the biggest driver in my lay opinion here, all right? Obviously, I'm just coming with the patient perspective, but I think that food here plays a massive, massive, massive role here, right? So let's start with the food and that's effect on driving up these colorectal cancer rates.
Yeah, so like let's dive into ultra processed foods because the data are emerging and the signal that we're receiving is, to be honest with you, upsetting. Brand new
Mhm.
study just came out November 2025 in the journal JAMA Oncology, where they followed nearly 30,000 women for 24 years. And they looked at the intake of ultra processed foods, and the women who consumed the most ultra processed foods, which by the way, it was a very large amount that they were consuming, but there are absolutely people who are doing this. 10 servings per day of ultra-processed foods. Those women had a 45% higher risk of developing the polyps that are the precursor to colorectal cancer. All right. Another study, Chuck, in a massive umbrella review where they're basically like trying to collect all of the best available data and they're pulling it all together. All right. They had nearly 10 million participants in this umbrella review published in 2024. And basically what they found is that ultra-processed food intake was associated with higher risk of colorectal cancer, but as more than just that, they actually found that there was a dose response. So in other words, as you increase your intake of ultra-processed foods from 10, 20, 30, up to the average American, 60%, as you increase that, the risk of colorectal cancer actually goes up. That not only really speaks to the strength of this association, but it also sort of is concerning when you consider the amount of ultra-processed foods that we're eating in America.
All right, indulge me for a second here. Just a little housekeeping. What's the difference between an umbrella review and a meta-analysis? Because it sounds like with an umbrella review, there's going to be a lot of data that's going to kind of get combined as they're going through it. So, what's the difference between the two?
Yeah, so a systematic review. Here we go, everyone. Let's get nerdy for a moment.
Nerd it out, baby.
Yeah. All right. If we were to look at the hierarchy of evidence, which this is a very important concept for people to know, because basically an anecdote is the weakest level of human evidence that exists. That is the crazy uncle who's like, well, I drank a 12 pack a day and I smoked 3 packs and I never got cirrhosis. That doesn't mean that alcohol doesn't cause cirrhosis. We clearly have better data than that, right? And so when we think about the hierarchy of evidence, you go from that to you go to population-based studies. The larger the population, the better, to randomized controlled trials. And then at the absolute peak, the best evidence that we have available are what we call systematic review and meta-analyses. So the idea is you do a systematic review. That's where, Chuck, I basically would publicly declare, this is what I'm going to study. Here is the method that I'm going to use in order to study it. And I'm going to go through and I'm going to find every single paper that qualifies under the rules that I have put into place. That's systematic review. And then meta-analysis is where you say, okay, now that I have done this complete and thorough review, I'm going to aggregate the data. I'm going to pull it all together into one place. And I'm going to basically use that consolidated data, which what we believe is important here is that this reduces bias, right? Because now I'm not cherry picking the study that I want to show a certain result. I'm pulling all the studies that qualify, and then I pull them all together and I do this meta-analysis. This is why we consider this to be a higher level of data, because it eliminates a lot of the bias that exists. But if you want to go one up above that, then we're talking about an umbrella review. And an umbrella review is where you have some broader goal of what you're trying to study and understand. So here's an example. You could do a systematic review to say, does ultra-processed food cause colorectal cancer? That would be a systematic review and meta-analysis. But if you do an umbrella review, you might say, does ultra-processed foods cause cancer? And then you're going to do a whole bunch of systematic reviews and meta-analysis. It's a ridiculous amount of work. But ultimately, when you're done, you're going to have this most comprehensive assessment of the first question that you asked that allows you to basically move forward.
School is in session, boys and girls. Professor Bulsiewicz at the head of the class.
This is why I spent all those nights at Northwestern getting a master's of clinical investigation, so I could have the 3 minutes of glory right there, Chuck.
I love it, man. I hope it was worth it. All right. So ultra processed foods. I mean, no doubt about it.
No comment. I'm pleading the fifth.
All right, no doubt about it here. It seems like kind of dead to rights. Ultra processed foods definitely implicated here. But what about processed meat?
Yeah, so we've all heard this, but it's important that we don't stop talking about this because the IARC, which is basically this independent international commission that takes a look at like what are the true carcinogens according to strict criteria, they've classified processed meat as a group 1 carcinogen. This is the highest level that exists. It's the same level as cigarettes. Now, it's important to understand it's not the same intensity of risk. So basically what that means is like smoking a pack a day is much higher risk for lung cancer than having an occasional deli meat sandwich is for colorectal cancer. Not the same, but here's the key. The certainty of evidence is the same. So in other words, they are completely convinced without a shadow of a doubt that processed meats increase your risk. And it's just a question of like how much are you consuming and how much does it increase the risk. But there's other issues out there, Chuck, beyond just ultra processed foods uh, and processed meats that there's the fact that like the American diet is very low in fiber. There's the fact that we have all these food additives in our food system, that there's things like dietary emulsifiers that disrupt our gut microbiome, reduce gut diversity, that starve the gut bacteria of short chain fatty acids like butyrate. So, and it turns out that like when you start to dig into this, what you discover is like there's these sort of competing things within our diet. One is the ultra processed and animal product side, all right, which is dominating. That's 90% of our calories. And then the other side is like the whole plant side, fruits, vegetables, whole grain seeds, nuts, and legumes that contain the fiber that are precursors to butyrate. And ultimately, it's the butyrate. It's the butyrate that becomes the key because the truth is, Chuck, without digging into too many of the details here, what they are discovering with total clarity is that the gut microbiome actually is a part of the risk package that exists here. So, and there's ways in which they believe that these gut microbes are directly playing a role in this transition from normal colon tissue to polyp to cancer. They think that the gut microbes are actually playing a direct role in that evolution into cancer.
That's a lot there. That's a lot. But before we move on, man, I really wish that there was a way that you smart research types could come up with a risk analysis that would give us, it wouldn't be a one to one, as you said, because, the risk isn't the same for um, one cigarette versus one slice of ham. But I would love to know, is it like 20 slices of ham that would be the equivalent of smoking one cigarette? Is it a half a pound of ham? Like, I wish that we had that actual comparison because I think that that would be really powerful knowledge. I'm not even sure that it would be possible to quantify anything like that. Do you think?
Here's the problem. These types of conditions that we're talking about, right? So, like colorectal cancer, we've already stated that it takes 10 to 15 years for a polyp to go from a polyp into cancer.
Yeah.
So, this is a delayed risk. So, we don't have randomized controlled trials where the outcome is cancer. And that is what makes this challenging is that ultimately you have to look backwards using population-based data. They do have an answer to the question that you have asked, Chuck, is like, what do we think is the risk of 50 grams of processed meats, deli slices or whatever it might be? What is the risk of that? And so you can do that, but the problem is like the accuracy of the data is the tricky part. Is that accurate when we're sort of retrospectively taking a look? I'm not convinced that the data in that is accurate. What I'm convinced is accurate is the connection between how you consume this food and then it increases your risk of colorectal cancer, because that question is not just a retrospective study and it's not just a single study. This is the buildup of multiple different studies, including mechanistic studies that ultimately allow us to like make this determination. So I think that's important to make that distinction.
Absolutely. But in case anybody is watching or listening at home and they're just curious, how much is 50 grams of ham? I did a quick Google search. It's one large deli slice. So if it's like thick cut, or two standard slices of ham, or if you get the thin shave, 3 to 4. That's according to Google AI. So take that with a grain of salt. But I would think that that's about right. It's been a long time since I've bellied up to the butcher's counter, man.
Yeah. Yeah. I mean, that sounds about right to me. Look, I think where my concern exists is above all else, if this is what you eat on a daily basis, that's where the problem is,
Yeah.
right?
Yeah.
Because there are people like that,
Hmm.
that this is their idea of lunch.
Yeah.
So can we create something that's healthier as a choice that is not going to contribute to your risk of developing, you said it off the jump, Chuck, 1 in 25 people. Dude, that is a scary number, 1 in 25 people. I mean, I
Yeah.
start to think about my high school. That's a lot of people from my graduating class in high school who are at some point gonna have to deal with this.
Insane number. 1 in every 25. It's figured there was like maybe a couple hundred kids in my graduating class, probably more than that. I can't remember. It was a fun time. My memory's a little bit foggy, but that's a lot. When you start to break it down, you think about all the kids in that auditorium and how many of them would have to stand up as that 1 in 25. That's a lot of kids, man. But let's see
Hey,
if we
man.
can't do some good and lower that risk and talk about prevention, because I know that you've laid out some good strategies for prevention. So, what are some of the best evidence-based strategies for lowering your risk of colorectal cancer?
I got 5, Chuck. You ready?
Go. Let's
All
go.
right. Number 1, you got to feed your microbiome. So I just a moment ago said that your gut microbiome has been implicated directly in the development of both polyps and ultimately the maturation from polyp into cancer. Your gut microbiome has been implicated. So what that means is we need to feed it fiber. Fiber is the good stuff. In a meta-analysis of 25 studies in the British Medical Journal, they found that every 10 grams of fiber reduces your risk of colorectal cancer by about 10%. Right? So 30 grams, 30%, 40 grams, 40%, and you go on up. Gosh, that's a beautiful thing. That's an opportunity. In the EPIC study, which was over 500,000 people from across Europe, they found that doubling your fiber intake could reduce your risk by as much as 40%.
Huge.
And then here's a really interesting one. I remember actually writing about this in my first book, Fiber Fueled, where researchers looked at the risk that exists with African American people. All right. So, just to contextualize, as a gastroenterologist, this is a vulnerable population. They're at increased risk. Not only is colorectal cancer more common, it's also more aggressive. And we're more likely to miss it because they're not getting caught, they're not getting screened as much. Right. So, this is a vulnerable population. So, and the question is like, where is that coming from? Because if you look at Native Africans, the risks are so low, off the charts compared to anyone in the United States, let alone the African Americans. So they did this swap study where they basically took the African Americans and they had them consume a traditional high fiber diet the way that people in Africa eat. And then they took the Native Africans and they basically provided them with an Americanized diet, high in fat, ultra processed foods, etc. All right. So 2 weeks, that's all it took. 2 weeks. And basically what they found is that the African Americans, when they increased their fiber, they had more butyrate being produced. By the way, butyrate is powerfully protective against colorectal cancer. They reduced secondary bile acids, which are thought to actually be carcinogenic. That's what happens when you reduce your fat intake, by the way. And they reduced specific markers of cancer risk. So 2 weeks was all it took to shift the microbiome and create an environment that actually could protect you as opposed to increase your risk.
Real quick patient question. You say secondary bile acids. What are those, my friend?
All right. So your liver, and if you have a gallbladder, your liver produces what are called bile acids. And part of what they do is to help you to process, digest, and absorb fat. So this is the reason why when people have gallbladder issues, high fat foods tend to give them more trouble because that
Mm.
gallbladder is getting more active. And so these bile acids, you're going to produce more of them when you're on a high fat diet. And there has been this association. I don't want to make it sound like they're all inherently bad. That would be an overreach. But some of these secondary bile salts, bile acids, some of them have been associated with increased risk of colorectal cancer. So basically, from a mechanistic perspective, the idea is that if you go from high fat, low fiber to low fat, high fiber, you are like basically flipping the script to increase your short chain fatty acid production. That's good. And reduce your secondary bile acids. That's also good. That's what you get from increasing, like basically replacing fat with fiber.
All right, good deals, man. Let's keep this train rolling on down the tracks. What's your second suggestion?
Number 2, move your body. So getting active, physical activity has been shown to be independently protective against colorectal cancer. And the most interesting study on this front is from a meeting that occurred last summer called ASCO, ASCO. And this is called the Challenge Trial. And this is the first randomized phase 3 clinical trial of exercise in people who are colon cancer survivors. And by the way, these survivors, so these are people who mostly had stage 3 cancer. That's a more advanced cancer. Okay. And after 8 years of following these people after the diagnosis of cancer, they found that the ones who were following this exercise program, they had a 28% lower risk of having a recurrent cancer. And they had a 37% lower risk of death. So that was 150 to 300 minutes of exercise per week.
I also saw a headline recently that took me aback. It said that runners actually have a higher risk of colon polyps. So what's happening there?
What's happening there is it's making me feel better about the fact that I would rather go work out and lift weights than become a runner, Chuck. That's what's happening there.
Right on. I
Okay.
don't mind you,
That's
Mr.
number one.
Ruckfest. I got you.
Yeah.
Okay.
Yeah. Well,
Okay.
the ruck vest, I'm not running.
No, I
Right.
know
So
you're walking. You're
I'm
walking, but you
walking.
weighted
I'm
down, baby.
walking. Yeah, baby. All right. So anyway, this study actually is kind of interesting because I just mentioned this meeting from last summer, ASCO 2025. Actually, this study was also presented at ASCO, and it must be. By the way, I feel a little weird talking about ASCO
Well, that was
when
the
we're
original
talking
name of
about
your
butts and guts here.
well, I was just thinking that was the original name of your company, but, you decided at the last minute to change it to the Gut Health MD, and, we'll stand
Okay,
whatever.
Chuck.
ASCO,
Oh,
ASCO.
buddy, you
Come
tossing
on.
me under the bus there. But
Well, peeling back the curtain, there's no bus tossing.
it's important to understand that this study has not been peer reviewed yet, right? So this is like an abstract at a meeting. But basically, what they did is they took 100 people who, and let's be clear, this is not a normal level of like casual running. These are the hardest of the hardcore. Where in order to qualify for the study, you had to either complete 5 marathons, 4
Mm,
was not enough, 5,
mm, mm-mm.
or 2 ultra marathons. So you could do a whole ultra marathon, and they'd be like, "You're a wimp. We don't want you from this study. We need 2."
This
Right?
is why I will never be part of this study, as you were.
So what they found is that 15% of these people, the hardcore runners, had what we call advanced adenomas. An advanced adenoma is a polyp that is on the verge of turning into cancer. So it's not cancer yet, but it's getting dangerously close. Now, 15% is a very high number because normally in this population, you would expect that number to be 1 to 2%. So, what they think is going on here is what we call colon ischemia. And basically, when you go running, your heart is going to prioritize blood flow to the parts of your body that need it the most in that moment. So, if you're running, that's going to be like going to your muscles, going to your brains, you continue to function, right? Going to your lungs. So, it reduces blood flow to the gut. And this is the issue that extreme athletes can run into. And so it can ultimately, like ischemia, starving the colon of oxygen, create damage that ultimately develops these colon polyps. That's the idea. It's important to be clear. I'm not saying exercise is bad. I just said exercise is good. Exercise protects you. What I am saying is there is such a thing as too much of anything. That's the issue,
Mm.
Chuck.
Well, maybe we should be handing out, like Cologuard boxes or coupons for free colonoscopies at the end of these
Yeah,
big old marathons, huh? Can you
they
imagine?
should. That would actually be pretty cool if they did that.
Yeah, I ran
So
26.2 miles, and what's my reward? You know, we're
colonoscopy.
getting we're getting
A
screened, baby.
colonoscopy at the finish
Let's
line. You
go.
collapse, and here comes Dr. B with that black thing.
Oh, what a day. All
Hey,
right.
keep that guy away from me. I
Oh
can't
my
even
God.
run. My legs are done.
He got me. He got me. All right. What's number 3 there, Chief?
Yeah, yeah. I feel like Dr. Octopus with the colonoscopy arms coming, just trying to scope people to keep them safe.
Oh no.
Um, all right. Number 3 is alcohol. So we want to. I mentioned earlier the carcinogenic effects. It's important for people to understand that the evidence is both strong and dose dependent, where like literally just one drink per day increases your risk by 7%.
Mm.
So we think that alcohol causes DNA damage. We think that it drives gut dysbiosis. And we also know that there's a metabolite of alcohol called acetaldehyde, which is inflammatory. So basically, like this is the mechanism that we think is going on.
Yeah, this is a tough one too, because I know that a lot of people like to unwind after a long day with that glass of wine, that beer, whatever the case may be. And then again, as we were talking about earlier, you go down to the man cave, you want to watch a game. Odds are you're belting off at least a couple, maybe three. It just, something that's so celebrated just appears, according to this evidence, to be so detrimental for one's health. I don't want to call it a shame, but it's definitely worthy of a lot more conversation.
Yeah, definitely not like we don't want to shame people, but I think that so first of all, there is another um, episode that I did as a solo on this topic, explaining why I made the decision to cut back my alcohol consumption substantially.
Mhm.
And so, for people who are interested, I would encourage you to go. I'll actually share that in the show notes for this episode.
Yeah.
I think that the thing I think about, Chuck, is like the power of our media
Yeah.
and the ways in which that creates this illusion of what is normal when in fact it doesn't need to be that way.
Yeah.
And so when you grow up during a time where there was the combination of Joe Camel, right? Like
I
Camel
remember
Cash.
Joe Camel. Yes, sir.
Yeah.
Yes,
Yeah,
sir.
Camel Cash. Like, dude, I was like literally 9 years old and like trying to find Camel Cash on the ground so that I could seriously, so that I could like send it in to camel.com and have them send me a t-shirt,
Yep.
after I
Yep.
get enough points so I can do their guerrilla marketing for them. Right.
Uh,
And the
the
same is
fine
true with
folks at the
alcohol. We had the
rewards.
Bud
Yeah.
Bowl.
Yeah. Oh,
We had
oh
the
my god, I forgot about the Bud Bowl.
dude,
Oh,
they're
yeah.
the good days of Super Bowl
That
commercials. That
was
used to be
so
fun.
good. The Bud Bowl, that was pre-Puppy Bowl. Like, that was the other bowl on Super Bowl Sunday was the
Dude,
Bud
give me
Bowl.
either of those two. The Bud Bowl or the Puppy Bowl is like, I mean, it's just an unfortunate thing that like we can't even have good commercials anymore. I feel like they've dropped the ball in recent years, personally. But
No, you've just gotten old, and that's all,
yeah,
and it's
yeah,
okay,
cynical,
dude.
cynical
So
dad
old is
mode.
beautiful, yeah. Stay off
Yeah.
my lawn. It's okay. Embrace your old crotchety self, man. The sooner you accept it, the better you're gonna feel.
All right. Well,
Ar
fair enough. But the point being that I think that the media has basically fed us this image that your life is better, that the fun times always involve alcohol, and that if you want to be the cool kid and be popular, you better be at that party and you better be drinking. Right? Like that's like basically what I grew up hearing. And so then I started to believe that to be true.
Yep.
And I don't think that like college culture really helps, unfortunately. And next thing you know, you can find yourself into these types of things that can cause trouble for people. And so the point from my perspective is that, look, it is not healthy. That's number one. Number two, do the good times outweigh the bad parts? That's like a legitimate question for people to wrestle with. And number three, dude, do you know how many great vacations I could have gone on if I'd never had a bar tab?
Mm. Those bar tabs are no joke. They are no joke. God, man, it's so expensive to drink. It really is. Like, it is re-daggone dick.
It's
You
gotten
think
worse.
about this, it's like $8 at your local pub for a pint these days, like, that's crazy. You try to get one before you go on an airplane, they're gonna ask you for, like, $15 for a single beer. Like, we're talking stadium prices. It's not worth it. It's just not worth it. But I will say, when it comes to alcohol, a lot of people use it for your 4th and 5th pillars, man. Sleep and stress management. Spoiler, I just gave them away.
Yeah, yeah. Well, I think it's good to combine these two and bring this home because like it's just important to understand the data are strongest with the first three in terms of protection.
Yeah.
But I do think that we should focus on other opportunities that we have in our lifestyle where the research may be earlier, but the opportunities are there.
Mm.
And so that includes circadian disruption and chronic stress because they both impact the microbiome, they both promote inflammation.
Yeah.
So ultimately, what we want is we want to flip from fight or flight mode, which is like sympathetic overdrive. We want to go from that to getting into rest and digest mode, which is rest, digest, and recovery mode. because that is the activation of our parasympathetic nervous system. And there's a number of ways to do this. I'm going to name some of them. And I just want to say before I name these, they all sound fantastic. We all want more of this.
Mhm.
You got to figure out a way to make time for this. And I'm not buying the you didn't have time if you're spending time on Twitter, right? So, like, there's better ways to use our time. This is my point. All right. But like meditation, breath work, prayer, exercise, sauna, yoga, you have options. Do whatever works for you. The key is that you are activating the recovery pathway.
Bro, let me tell you, of those options, I checked a lot of them off over the last 3 years as I was trying to recover and get back to normal. Breath work absolutely works. That goes hand in
Ah,
hand for me when it comes with meditation. Definitely hit up some sauna, did yoga like a champion for a long time. Exercise really was limited to more or less walking, but I know that what separated good days from bad days was when I was more active and gave my body an opportunity to release a lot of the stress and anxiety that comes with being chronically ill. Just made me feel so much better physically and mentally, and helped me like continue the fight. And I think that a lot of people who are struggling with their health should turn to these things because they are super beneficial for so many reasons.
yeah, I tend to agree with you, Chuck. And also, like, it's amazing how far we've come when it comes to yoga pants for men. You know, I mean, you got options. You got
Well,
options. You can decide what you want to wear there. Are you going with sweats? You going with
um,
shorts? You going tight?
I probably shouldn't tell you this, but it was actually nude yoga, and so I didn't have to worry about fancy pants. I just had to show up. It
No
was
wonder
good.
you were doing that 6 times a day, Chuck. What is going on there?
Hey man, I'm nothing if not dedicated to the craft.
Yeah.
But jokes aside, no nude yoga for me, my friends. But this does sound a lot like nude yoga aside. The plan that you put together recently in Plant Powered Plus.
Yeah, I think that, like, the bottom line is that Plant Powered Plus was the consummation of 3 years of research to answer the question of how do I make the gut microbiome healthier? How do I repair and restore the gut barrier? How do I reduce inflammation? So everything that you find in that book are the evidence-based tools that allow you to fulfill that. And what we're saying in this episode that people need to hear is that your gut microbiome and inflammation are how we create this pathway to go from normal tissue to colon polyp to colon cancer. And so if we want to disrupt that, we need to make the microbiome healthier. We need to reduce inflammation. That's exactly what Plant Powered Plus is designed to do. So I think, it's worth saying that the reason why you're hearing sort of like, hey, these sound a lot like what's in that book. Yeah, because it's the same pathway. That's what we want.
Yeah, man. Now let's continue on. And you just mentioned that 10 to 15 year window. You previously called that a gift, and with the gift comes the big decision. And that is like, should you get screened? Because look, man, I hear so many people, Dr. B, say that if you eat enough fiber, you lead that healthy lifestyle that you've been talking about, you simply won't get colon cancer. Is that actually a true statement, though?
That's not true.
Hmm.
That's not true. That's definitely not true.
Talk to us.
And I sadly have lost patients who that was their approach.
Hmm.
So I've seen it firsthand, but it's backed up by the data with clarity. The Adventist 2 study, which was research in the Seventh day Adventists in Loma Linda, California, they took a look at vegetarians, including both vegans and vegetarians, and found that they had a 21% lower risk. All right, so that is protective. That is lower, but that's not a 100% lower risk. That's not a 98% lower risk. So the point is, like, lifestyle is great. You should do it, but that is not reducing your risk as powerfully as you would want.
Yeah.
So, basically, the way I see it, Chuck, is that screening offers us if it's done properly, two great opportunities. The first is actually you can prevent cancer. So don't you want that? Don't you want to prevent this from actually turning into cancer? I said it's a gift that you have the 10 to 15-year window. If you find the polyp and remove it, you just prevented cancer. And number two, don't you want to catch it as early as possible? Yes, you want to catch it preferably as a polyp. But if it's not going to be a polyp, if I have to be diagnosed with colon cancer, please let it be stage 1. Because stage 1 cancer has been shown to have a greater than 90% survival at 5 years. Whereas when you get to stage 4, where it's metastatic, your likelihood of surviving at 5 years is less than 15%. That basically then, sadly, the chips are stacked against you. So we want to catch it early.
Yeah, and you actually have a pretty, heartbreaking story about that.
Well, actually, the story was encouraging because I had a case. This actually happened a couple times where the patient had a very large polyp on a stalk. You see it. It doesn't look like cancer. I'm going to tell you, cancer looks a certain way, Chuck. This doesn't look like cancer. This looks like a big polyp. You remove the polyp, and then the pathologist calls you up and they go, the pathologist says, I just want to tell you, Dr. B, that polyp had cancer in it. And you triple check and you realize there's no cancer left. You just cured cancer. That's the power of screening.
Yeah, you pull it out by the roots, man. That's huge. But at the same time, it's like I hear you, and I know that I said it was going to be a heartbreaking story. You gave us a twist here, and it makes me think like you're setting yourself up to be like Captain America over there, like curing cancer. So it's like, I don't know, man. You feeling yourself? You're going to cure world hunger next? What's going on? What's the next flex?
I mean, I am feeling myself, but at the same time, that doesn't mean I'm ready to go, don the Captain America tights. I don't think anyone wants to see that. And not to mention, like, you could strut your way into a colonoscopy and then, you got to remind yourself, like, if you're walking into a colonoscopy suite, this is not an Avengers movie. Like, you're going to be smelling stinky smells. You get over yourself, buddy.
Nonetheless, though, like if you were to go Hollywood, I think it'd be like The Colonoscopist, rated PG-13 for violence against polyps. Dr. Will Bulsiewicz stars.
I mean, I'm pretty sure it would at least be rated R because there would be some butt shots in there. So
tasteful nudity.
Yeah. I don't think it would do too well in the box office, but if it impacts colon cancer survival, that's a good thing, right?
Yeah, absolutely. I mean, there's no question about it. But let's talk about colonoscopy, man. Is that really the gold standard?
Yes, this is the gold standard. Everything else gets compared to this.
Mhm.
Is the absolute best at detecting polyps. It can detect polyps of any size, from the smallest size to the largest size. The polyps can be removed on the spot, and colonoscopy, it's a one-stop shop. So basically, you schedule, you do your procedure, and you're done.
All right, man. Like all of that sounds great. It sounds really simple, but a lot of people are really apprehensive about undergoing it. So, what are the risks?
I mean, everything comes with risks, right? What's more likely to kill you, getting a colonoscopy or driving your car?
Mm.
So you just have to be real with it. The risk of colonoscopy is mostly around, like literally everything has risks. You could take a medication that's going to save 100,000 people's lives, but you could be the one who has an adverse effect from it. So the main risks that we think about are bleeding or perforation. These are very rare. Perforation, by the way, means like a small puncture in the colon. These are very rare, and they both can be addressed pretty quickly with the tools that we have. So there is a risk of bleeding, there is a risk of perforation. They're very small, clearly less than 1% risk. Perforation less than 1 in 1,000. And again, the vast majority of the time, it's something that can be addressed pretty quickly.
I want to hammer home this point just really quickly that you actually have a greater risk of having something bad happen while you're driving to the colonoscopy than you actually do with the colonoscopy itself.
I mean, I would, I don't know about that one time driving, but like in general, we hop into our car every single day, and how many people have life-threatening accidents on a yearly basis in America. And the number of people that have something very, very serious happening on a colonoscopy is so exceedingly rare. It gets overstated. It drives me nuts, honestly.
All right. One of the reasons that a lot of people also put their foot down when it comes to getting a colonoscopy, they say, hell no, I won't go, is because of the prep. And on the exam room, you and I have talked at length about what effect prep might have on the microbiome. But for the benefit of those who haven't joined us over there, how does the microbiome become affected by that massive clearing out before the
Yeah, I
colonoscopy?
mean, it's part of your microbiome. When you flush out completely for a bowel prep, you are flushing out your microbiome on some level. That being said, you bounce back very quickly. This is not the same as taking antibiotics for 7, 10, 14 days, where you're basically like during that period of time flogging the microbiome on a daily basis. That's not what's happening. One shot deal, immediate recovery. The ultimate question with every single choice that we make when it comes to our health is benefit versus risk. What is the benefit? This protects you from the number 2 cause of cancer death in America. What is the risk? Rather small. It's overwhelming.
Let me ask you, we joked about Cologuard earlier, but in all seriousness, what should we know about that, at home option?
Does not compete directly with colonoscopy. Colonoscopy is clearly a superior choice from my perspective. So let's just be upfront about that. Cologuard will not allow you to find, in the vast majority of cases, will not allow you to find early polyps. It's really not good at detecting the advanced polyps. So like the ones that are on the verge of cancer, but not quite there. Cologuard is not that good. Like it's 50-50 for that.
Hmm.
And then when it comes to cancer itself, which is the idea, like the idea behind Cologuard is you want it to trigger when there's cancer, which allows you to hopefully find the cancer a little bit earlier. There's merit to that. I would definitely recommend the Cologuard over nothing. But the problem is that the Cologuard has been found to miss about 8% of cancers. And that to me is unacceptably high.
Yeah.
So, because like you can't afford to have cancer and then have your test be negative and you're just like, oh, well, nothing to worry about here. So to me, like for myself, for my friends and family, I'm talking them into colonoscopy. But for everyone else who's here listening, you have a choice. I don't think that not screening should be a good choice ever. So you got to choose something. I would really love for it to be colonoscopy. I think that's the best test. But if you're not going to do that, do a Cologuard. I'll take it.
What about the third option? And that's this new blood test that I've heard a little bit about.
Yeah. To basically like shorten this down, it's not ready for prime time from my perspective when it comes to
Mm,
this.
mm.
So take the 8% miss rate for Cologuard and double that,
Gotcha.
right? And that's what you're getting at, like even more cancers being missed.
That's way too many cases, in my opinion. So what's the bottom line on screening right now?
Bottom line is that I think that everyone should take advantage of screening opportunities. And in the United States, that starts when you're 45 years old.
Mm.
So if you have a family history, then you could potentially go earlier than that. But I think the point from my perspective is like, hey, I'm not telling you on the day that you turn 45 that you need to have a colonoscopy that day. But what I am telling you is like you should set a reminder for yourself within a week of your 45th birthday to be like, hey, I'm going to call up my gastroenterologist and go and get this done.
Pro tip, don't do it the day of your birthday. Don't do it the day after, because that means you'll be doing prep on your actual birthday. Two days after your birthday. That is the ideal time to get that done. That said, because of everything I've been going through, like I've had, golly, at least two in the last 5 years outside of the prep, and the prep wasn't even that big of a deal, Dr. B. So like I'm glad I've got that peace of mind. My colon was clean as a whistle on in both cases. But having that peace of mind makes me feel really good, man. That said though, for somebody who is our age, I'm 43 right now. Somebody is not 45, but you have convinced me that there is some concern here because the colorectal cancer cases are rising among our young demographics. So for the younger folk, not 45, how then should they go about protecting themselves?
All right, here's the key 45, screening, boom. All right, we've taken everyone 45 and older. If you haven't been screened, go get screened. All right, now I'm turning to everyone who's under 45. You're not yet there yet. So you don't qualify for screening. What do we do? How do we keep ourselves safe? Yes, diet. Yes, exercise. Yes, reducing alcohol and all these things that we've been talking about. But here's the other thing. Be vigilant when it comes to symptoms. So I'm going to tell you the exact red flag symptoms. And my point to you is don't sweep this under the carpet. Take this seriously. If anything, use this as an opportunity to have a conversation with your doctor to get things done. Because with these symptoms, you qualify for diagnostic evaluation, which includes colonoscopy. So the red flags that you need to know about: blood in the stool. All right, you're seeing blood. Don't assume it's hemorrhoids. Low iron levels without an explanation. Anemia. When you're losing weight, you're not sure why. Worthy of check. When you have chronic abdominal pain, or there's a change in your bowel habits, these, Chuck, are all of the reasons that you want to potentially go and get colonoscopy, get checked.
What about that family history? If you have that strong hereditary link, what should a person do then?
Yeah, the best thing, there's many permutations of what this could be. The point is, go and talk to your doctor. Because if you have a family history of any variety, even if it's advanced polyps, right, or anyone in the family with cancer, talk to your doctor. They'll know what to do. They can give you good advice.
Right on. All right, man. Well, let's kind of wrap things up here and take it home, man. What are some of the underlying messages we should be taking away today?
All right. Well, so we've discussed like the very real thing that's happening, which is that colon cancer is on the rise in younger adults. All right. And it's time for us to get real. And what that means is like having a plan of attack. But here's the important thing for you to know. You're not helpless. We have strategies. We've discussed this today. You just need to put this into action. So basically what that means is, number one, every single one of you, activate these diet and lifestyle elements. Prioritize fiber. Prioritize exercise. Limit or avoid alcohol. Focus on your sleep. Focus on your circadian rhythm. Take advantage of the opportunities to get to reduce stress. So like if naked yoga is your thing, hey, I mean, seriously, if there's no, look, if that's your thing and that's how you de-stress, go for it. Like
That's
I'm
my
for
drink.
it.
Just
Yeah.
clean them out afterwards.
I don't just mean you. I mean, like everyone who's listening. It's like, look,
Yeah.
we could have an entire community of people. This is what we do. But do those things. And then when you are before 45 in America or before the screening age in your country, a lot of other countries it's 50. If you're before that age, be vigilant about these symptoms. You see blood in the stool, anemia, iron deficiency, unexplained weight loss, chronic fatigue, chronic abdominal pain, change in your bowel habits, any of these things. Okay, go get checked. Go talk to your doctor. And then once you hit that screening age, I am saying to you, I don't care which version of screening you do, I expect you to do it because this is how we keep people safe.
Dude, that was a dead serious delivery. So it sounds to me like this is one of the, if not the top issue for you as a gastroenterologist. This is massive.
I mean, this is a huge issue for me, Chuck, because once again, as I said, right from the lead off, I've seen people in their early 30s whose life was saved. That patient, her life was saved. I specifically have a person in mind. Of course, I can't say more about that, but specific person where her life was saved. I know her family, and colonoscopy saved her life. But also I've had far too many people that I've diagnosed with this health condition, and they're not all old. So let's move past the idea that this is an old person's health condition, and let's get vigilant in our 20s, in our 30s, in our 40s, and let's protect ourselves.
Let's do it, man. Let's do it. I think it would be criminal not to do something when you've pointed out so eloquently that there's just so much that we can do. We have so much more power than we give ourselves credit for. So, Dr. B, I can't think of a better way to wrap things up than with that, my friend. So let's go ahead and put a bow on this episode of The Gut Insiders. And if you, my friend, understand colorectal cancer in a new way, if it moved you to schedule that screening, have no fear, my friend. Share this with someone who needs it as well. You know, we're all in this together. So hit like, subscribe, pass it along, share it. And this, honestly, Dr. B, is one of those episodes where sharing it literally could save someone's life. So until next time, I am Chuck Carroll with the Patient Perspective. He's Dr. B, the Gut Health MD. Thanks so very much for watching The Gut Insiders.